Bismillahirrahmanirrahim, and welcome back to this next video. And this is the third video in the series of videos on the Huntington disease, which we were discussing as an example of the autosomal dominant genetic diseases. In the first two videos, I've generally told you that what is the Huntington disease. Then we talked about the genetics of the Huntington disease, that it is an autosomal dominant disorder in which there is a mutation and you get higher number of the CAG repeats in the Huntington protein, and that is going to lead to neurological disorders or neurodegeneration. We talked about the functions of the Huntington protein, how that play an important role in the normal physiology of the human beings, and then we discussed about the different scenarios about the inheritance pattern of the HD. Now, in this particular video, I want to focus on the symptoms of the Huntington disease in a little bit of detail. Now, when you talk about the symptoms of the HD, the symptoms that usually start at the age of 30 to 50 years, but can begin much earlier or later. Now, the symptoms, they are of, you can say, a different nature. When you talk about the physical symptoms of the Huntington disease, there is actually involuntary jerking movements of the limbs and body and difficulty moving. And this particular, you can say, involuntary jerking of movements of the limbs, that is technically known as the chorea. Now, when you talk about the second physical symptom that you can see in the patient of the HD, that there is a rapid movement of the eye, which is used to focus from one object to another. There is also loss of motor coordination and the fine motor movement. For example, there is a difficulty writing. So these are some of the physical symptoms that you can see in the patient of the Huntington disease. The second type of the symptoms that you can see in the HD patients, they are known as the cognitive effects, how the HD is going to affect the cognition or the learning abilities of the individuals. There is actually a reduced short-term memory. There is impairment in concentration. So the patient of the HD, there is problem in the concentration, and they cannot concentrate just like the normal individuals on particular things. There is also difficulty with communication. For example, there is slow or the slurred speech. There is difficulty finding words, and there is disorganized speech and sentence construction. So these are some of the cognitive effects that you see in the HD patients. When we talk about the behavior or the personality changes, so there are changes in personal hygiene and habits of the HD. There is irritability and aggression in the HD patients. Sometimes the depression is also noted in HD patients, particularly in the later stages. One of the most important personality change that occur in the HD patients, that is known as the paranoia. And this paranoia is actually an irrational and persisting feeling that people are out to get you, or that you are the subject of persistent intrusive attention by others. Now, this problem, when they always feels that people are there to get them, this unfounded mistrust of other individuals can make it very difficult for a person with HD or for a person with the paranoia to function socially or have close relationships. So they are very poor in maintaining the social relationships or maintaining the close relationships. And that is actually a major personality change that you see in the HD patients. There are also dementia, which is actually when you forget something, that actually refers to dementia. There is also a difficulty concentrating and memory lapses in the HD patients. There are mood swings and personality changes, and there are problems swallowing, speaking, and breathing. All of these stuff, if you see, all of these, they are controlled by the nervous system, and as there are breakdown in the or there are you can say destruction of the nerve cells in the HD patient, there is neurodegeneration, and as a result of those neurodegeneration, this kind of the personality changes or the behavior changes, they are actually happening in the HD patients. And full-time nursing care that is needed in the later stages of the HD condition. When you talk about the diagnosis of the HD, so the major diagnosis, that is the molecular genetic testing. And in the molecular genetic testing, what you do is that you are going to estimate the length of the CAG repeat mutations in the Huntington gene, because this particular condition is because of the mutation in the CAG repeat mutation, and normally the CAG segment is repeated 10 to 35 times within the Huntington genes, but in HD patient it is repeated 40 or more than 80 times. And because of this mutation, there is actually the neurodegeneration. So when you talk about the testing that is actually carried out by the molecular genetic testing, and the person's DNA that is sequenced to look for the number of the CAG repeat in the Huntington protein. There are also imaging tests which are not that much helpful, but they are carried out to you can say identify the patients with the HD or any brain deterioration in the individual with the HD. And the most common imaging tests that are used, they are the MRI and the CT scan. And the scans, the MRI or the CT scan, they are actually used to show the areas of the brain degeneration. As I told you, they are not very useful, but in the early HD stage, they can actually but they cannot allow you to show, they are unable to show you the small region of the brain deterioration, but in the later stages that can actually help you identifying the areas of the brain that have gone through the deterioration. When you talk about the treatment, the simple rule for the genetic diseases is they are not curable, and all of the treatments they are available, they are usually supportive in nature. They are usually carried out to minimize the symptom of that particular disease, and same is true for the Huntington disease as well. So currently there is no treatment available for the cure, and most of the treatment they are supportive. The medications are given to individuals of the HD patient, which help control the erratic behavior in the movements, or you can simply say the medication they are used for the treatment of the chorea that we just discussed. The physical and the occupational therapy, as well as the therapy for the speech, and in helping swallowing, those kind of the therapies they are used as a treatment for the HD patients. There is counseling and the caregiver support for the patient of the HD. Now, when we talk about the possible options for the treatment of these genetic diseases, that is the gene therapy. But the gene therapy that is usually you can say this technology is still in its infancy, but that is a hope that with the help of the gene therapy one day we will be able to treat the genetic diseases. Now in 2008 the tetrabenazine that became the first medication approved by the FDA to treat the involuntary movements or the chorea, but most of the focus currently is on the option of the gene therapies, because in the gene therapy that can actually prove a very useful tool. And what you do in the gene therapy generally is that you are going to replace the mutated gene with a normal copy of that particular gene, and if you are successful in replacing the mutant gene with a normal gene, you can theoretically treat the Huntington disease. So this is all about the Huntington disease. So if you like the video, please subscribe to my channel, hit the like button and share it with your friends.